you so much, Greg. You know, we talk a lot about us being in the middle of a very bad flu season, particularly in recent years, but the chill and the dry air, they really contribute to a number of other winter health problems. So we have Dr. Sharice Wiley here with Baylor Scott White Health to talk about some of those common health conditions that spring up during the winter. See what I did there? Spring up winter. Dr. Wiley, the dry skin. Oh my goodness. I try to moisturize. I'm trying to stay on top of it, but even just picking something up, the skin stretching, it hurts, it stings. What can we do about this dry skin we're dealing with?
Yes, we all have those woes. You know, the important thing about treating dry skin is to recognize that it's important to nourish the skin not only on the outside but also on the inside. So drinking more water.
Really staying hydrated helps?
We tend not to drink as much water during the winter months. We're not as thirsty, so making sure that you're staying hydrated. In addition, when you do put on those outer moisturizers, making sure that you do it after you bathe. That's the best time to do it. Now, we know that, you know, dry skin has no racial barriers. We all have dry skin, but research tells us that people of African descent have drier skin than those of Caucasian descent. And this has to do with the way that the skin retains water. So, depending on your skin needs, you may consider thicker emollients such as cocoa butter or my favorite, which is shea butter.
Shea butter.
The more pure, the better. And even Vaseline. It just tends to be a little greasy.
Some people tend to just slather on the petroleum jelly, but
Vaseline's okay, but it can clog the pores, especially in the face. So you just may want to be careful of that. And then adding a humidifier is always good.
Oh, that might help too. All right, so let's talk about the sun exposure now, vitamin D. Do we tend to see more people with a vitamin D deficiency this time of year?
Yes, especially if that's your sole source of vitamin D, because the sun does make vitamin D. So when you're exposed, you make vitamin D. The darker the skin, the more vitamin D or sun exposure that you'll need. It is important to recognize all of the important things that we obtain from vitamin D. So vitamin D is important because it helps with bone health. It prevents us from having fractures, leading to osteoporosis that leads to fractures. It also, research also tells us that vitamin D is important in preventing some cancers, in preventing some autoimmune diseases, and it's also important for cognitive health. So if you don't know your vitamin D level, it is important to find out from your doctor how much vitamin D you actually need, because supplementation is the most important way.
Keeping it maintained.
Yes, for sure.
Very good. You know, another problem, nosebleeds.
Oh, yes.
So is it the cold air, or is it when you crank on the heat and then it's the dry air?
You know, maybe a little bit of both. What actually happens is that nasal mucosa, or that thin lining in the nose, it tends to the moisture tends to evaporate from that. So then you get these thin cracks which tend to expose the blood vessels, causing nosebleeds. So again, the best things to do are Vaseline, that helps retain the moisture. You also can
actually use it in your nose?
You can use Vaseline in your nose. I tell patients to use a Q-tip, put a little Vaseline in their nose, but the best thing to use is a nasal spray. So you can purchase that over the counter. It's a nasal saline spray. You can use that 3 to 4 times during the day, and that's important, as well as a humidifier, again, which adds moisture back into the air.
And you're using the Vaseline ahead of time to maintain the moisture, not after you've gotten a nosebleed.
To maintain, in addition, if you have dry nasal mucosa, you also can apply Vaseline as well, because it is soothing.
Okay, good to know. And quickly, on that same, in the same vein, nose, respiratory asthma, I would imagine it's a little bit tougher for folks with asthma this time of year?
Yes, some people, this is actually their trigger, the cold weather. So you want to make sure that you are trying to stay out of the cold when it's windy, when it's real cold outside. If you have to go, loosely put a scarf over your face. Make sure you're maintaining your maintenance therapy, you're taking that, not forgetting it, and keep a rescue inhaler close, because you may have a trigger of your asthma from the cold weather. I'll be glad when it warms up.
You and me both. But you've offered some phenomenal tips. So
thank you
so much for joining us this afternoon.
Thank you for having us.
Appreciate it.
Thank you.